Have you ever wondered which liver disease is not only the most misdiagnosed but also the worst of them all?
No, it's not the one you're probably thinking of.
It's Crigler Najjar syndrome, a condition so rare and tricky that it could easily win the "Where's Waldo" of liver diseases.
But why is it the worst, you ask?
Well, it's not just because it can poison your brain with bilirubin, turning a simple liver issue into a full-blown neurological crisis. Buckle up, because I'm about to take you on a journey through the twists and turns of a disease that plays hide and seek like no other. I am V, and welcome to the best health channel on YouTube, where we talk about everything related to your health and well-being. Picture this. A young woman in her early 20s, vibrant, full of life, but suddenly, her body starts to betray her. Every day brings a new symptom, a new challenge. Her liver, that vital organ supposed to be her ally, becomes her nemesis. Doctors are baffled, treatments seem futile, and the diagnoses keep changing like the seasons. From one liver condition to another, they guessed, but nothing fit. It was like trying to solve a puzzle with pieces that just wouldn't match. As her condition worsened, she found herself bound to a wheelchair, a prisoner in her own body. But then, when all seemed lost, a new twist. A diagnosis of Crigler Najjar syndrome. It's like finding out you've been fighting the wrong enemy all along. With the right treatment, she began to reclaim her life, one step at a time. But why was this disease so elusive? Crigler Najjar syndrome is usually a disease diagnosed shortly after birth, making its rare appearances in adults a true medical anomaly. This lady was an outlier, part of a minuscule percentage who slipped through the cracks of early diagnosis. This oversight is partly why her neurological symptoms, confusion, lethargy, hypotony potentially leading to irreversible brain damage, escalated to such a dire state. So, why am I making this video? Consider it an eye-opener, a beacon in the often murky waters of medical knowledge, especially about those conditions that lurk in the shadows, misunderstood and frequently misdiagnosed. We're shedding light on Crigler Najjar syndrome, a condition so rare and complex, it's often overlooked until it becomes alarmingly severe.
What will you learn today?
We're diving deep into the heart of Crigler Najjar syndrome, peeling back the layers to understand.
We will discuss what causes it, symptoms, complications, and why it is considered dangerous, and as well treatment options.
But knowledge is just the first step. I urge you to engage. Ask questions, share your thoughts or experiences in the comments below. Have you or someone you know faced a rare disease? How was the journey? If the information you are looking for is missing in this video, please ask about it in the comment section and I will answer you. Don't forget to like, share, and subscribe. What is Crigler Najjar syndrome exactly? Crigler Najjar syndrome is a very rare liver condition that you inherit from your parents, which means it's passed down through families. It happens because of a problem with an enzyme, a type of protein that helps our bodies do various tasks. This specific enzyme, called uridine diphosphate glucuronidyltransferase 1A1, UGT1A1, is supposed to help break down a yellow substance called bilirubin that our bodies make when they get rid of old red blood cells. In healthy people, bilirubin gets processed by the liver, turned into a form that can be removed from the body through our poop, making sure it doesn't build up. But in someone with Crigler Najjar syndrome, their body can't do this job properly because they either don't have enough of the enzyme or it's not working right. Because of this, bilirubin starts to build up in the body, which can make the skin and whites of the eyes turn yellow, a condition known as jaundice. If the bilirubin level gets too high, it can be dangerous and affect the brain. Types of Crigler Najjar syndrome. There are two types of Crigler Najjar syndrome. Type 1 is more severe because the body makes very little to no enzyme at all, leading to very high levels of bilirubin. Type 2 is less severe because the body still makes some of the enzyme, so the bilirubin levels are not as high. For newborns, it's especially important to watch for and treat this condition early because high bilirubin can be more harmful to babies. However, it's a condition that needs to be managed throughout a person's life. The symptoms of Crigler Najjar syndrome primarily revolve around the buildup of bilirubin in the body, leading to jaundice. This is the most noticeable symptom, where the skin and whites of the eyes turn yellow. It's a direct result of high bilirubin levels in the blood. Fatigue. Individuals may experience unusual tiredness or weakness. Abdominal pain. Some people might have pain in the belly area. Dark urine. The color of the urine might turn darker due to the excess bilirubin being processed by the kidneys. In severe cases, particularly with type 1 Crigler Najjar syndrome, if the bilirubin levels become extremely high, It can lead to more serious neurological symptoms due to bilirubin's toxicity to the brain, such as confusion or altered consciousness. High bilirubin can affect brain function, leading to confusion.
Lethargy, a state of weariness that involves diminished energy or enthusiasm for activities. Difficulty feeding in infants. Babies may have trouble feeding or sucking.
It's crucial for those with Crigler Najjar syndrome to manage their condition closely to prevent bilirubin levels from becoming dangerously high and to avoid these symptoms, especially the more severe neurological ones. Crigler Najjar syndrome, particularly in its most severe form, type 1, can lead to significant complications if not managed carefully. The primary concern is the high levels of unconjugated bilirubin in the bloodstream, which can lead to several serious health issues, making the condition particularly worrisome and dangerous.
Complications of Crigler Najjar syndrome.
Kernicterus. The most severe and feared complication is kernicterus, a form of brain damage caused by the excessive buildup of bilirubin in the brain tissues. This can lead to irreversible neurological damage, manifesting as hearing loss, intellectual disabilities, and movement disorders. In infants, it can be fatal if not treated urgently.
Neurological dysfunction. Before reaching the levels severe enough to cause kernicterus, high bilirubin can still affect the nervous system, causing symptoms like lethargy, difficulty maintaining consciousness, and seizures. Bilirubin-induced neurological dysfunction, BIND, even at lower levels than those causing kernicterus. Bilirubin can still impair nerve function, potentially leading to subtle cognitive and motor deficits over time. What makes Crigler Najjar syndrome dangerous? Invisibility of early symptoms. Initially, jaundice might be the only symptom, which can be easily dismissed or mistaken for less severe conditions. Without proper monitoring, bilirubin levels can silently reach dangerous levels. Lack of awareness and misdiagnosis. Due to its rarity, there's a lack of awareness about Crigler Najjar syndrome, even among healthcare professionals. This can lead to misdiagnosis or delayed diagnosis, increasing the risk of severe complications. Challenges in management. The strict and lifelong management required for Crigler Najjar syndrome, including daily phototherapy for type 1 and potentially liver transplantation, is complex and burdensome for patients and their families. Restrictions on daily life. The disease imposes significant lifestyle restrictions to avoid triggers that can increase bilirubin levels, affecting the quality of life and mental health of those affected. Why it's considered the worst. Crigler Najjar syndrome is often dubbed the worst because it combines the invisibility of early symptoms with the potential for catastrophic outcomes like kernicterus, requiring a high level of vigilance and healthcare intervention to manage a condition that is both rare and poorly understood. The severity of its impact, especially in type 1, and the lifelong management it necessitates, sets it apart in terms of the challenges it presents to patients and healthcare providers alike. Treating Crigler Najjar syndrome focuses on managing bilirubin levels to prevent them from reaching dangerously high levels that could cause kernicterus or other complications. The approach varies depending on the type of Crigler Najjar syndrome, type 1 or type 2, but generally involves the following strategies. Phototherapy, light therapy. For type 1 and type 2, phototherapy is a mainstay treatment, especially effective in newborns and young children. It uses blue light to break down bilirubin in the skin, making it easier for the body to eliminate it. This method requires many hours per day under the light, which can be challenging, especially as patients get older and their skin thickens, making bilirubin harder to break down by light alone. Medication. For type 2, patients may respond to phenobarbital, a medication that can help increase the liver's ability to process bilirubin. However, this is generally not effective for type 1 Crigler Najjar syndrome. Plasmapheresis. In severe cases, a procedure called plasmapheresis might be used temporarily in acute situations to rapidly decrease bilirubin levels. This process involves filtering the blood to remove bilirubin directly. Liver transplant. Definitive treatment for type 1. For those with type 1 Crigler Najjar syndrome, a liver transplant may ultimately be necessary. This surgery replaces the patient's liver with a healthy one from a donor, effectively curing the condition by providing the missing enzyme needed to process bilirubin. While liver transplantation is a major procedure with its risks, it offers a permanent solution for those with the most severe form of the syndrome. Experimental treatments. Gene therapy. Research into gene therapy is ongoing as a potential treatment for Crigler Najjar syndrome.
The goal is to introduce a correct version of the gene responsible for producing the enzyme that's deficient in patients. This approach aims to provide a long-term solution to manage bilirubin levels without the need for liver transplantation or lifelong phototherapy.
Regular monitoring. Regular blood tests to monitor bilirubin levels are crucial to manage the condition effectively.
Supportive care. Nutritional support, mental health care, and other supportive measures can help manage the impacts of the disease on daily life. Treatment requires a multidisciplinary approach involving pediatricians, hepatologists, gastroenterologists, and potentially transplant surgeons, along with supportive care providers. While managing Crigler Najjar syndrome can be complex, advancements in treatment and care continue to improve the quality of life and outcomes for those affected by this rare condition. As we wrap up our exploration of Crigler Najjar syndrome, we've delved into not just the medical complexities of this rare condition but also the incredible strides being made towards better treatments and, hopefully, a cure. This journey underscores the importance of awareness, research, and community support in tackling such challenging diseases. While the path ahead is filled with both hurdles and hope, each step forward in research and awareness brings us closer to a brighter future for those affected. Your engagement and support play a vital role in this journey. Thank you for spending this time with me to shed light on Crigler Najjar syndrome. Let's keep the conversation going, share this knowledge, and contribute to a world more informed and supportive of those facing rare diseases. Don't forget to like, share, and subscribe for more content that makes a difference.